Good morning everyone, welcome back to my channel. Lesleyanne here. Okay, so now today's video is going to be a little bit different. Quite a few of my subscribers have actually asked me to do this video, and it's rheumatoid arthritis, when I was diagnosed, how I was diagnosed, and kind of how it affects my life really. So if you'd like to carry on watching this video just to get a little insight into it, I'm not feeling fantastic at the moment, so that's kind of prompted me to actually do the video. Have yourself a cup of tea or a cup of coffee or something, and then come and join me for the rest of this video. Right, I'm going to sit back in my chair and try to think about where to begin really. I have got a terrible rash, as you can see here, all over my neck. I've got it on the inside of my arm, so I'm kind of quite eczema-ish at the moment. I've got this exact same rash from the waist all over my stomach and down the front of my thighs as well, and it is something that, I mean, I do get eczema to do with the autoimmune disease, but excuse me, but some of it is. Okay, now where do I start? We'll start years ago, many years ago, when I was probably, I don't know, about 18, something like that. Between 18 and sort of 25, I would often have an awful lot of pain in my knee, both knees, and they would lock, and it would be so painful, and I couldn't unlock them, and there'd be so much swelling that I had to call the doctor, and a fair few times I had injections in my knees, which I now know were probably some sort of a steroid injection. To be honest, I didn't take an awful lot of notice at that time. I don't know what I thought it was. I didn't think anything. I probably just took everything for granted and just thought, oh wow, I've got bad knees, and that was it. And then, well, then I had my babies. I've got 6 children. I've got a set of twins as well, so I had 5 pregnancies, and during the time when you're pregnant, all your ligaments and joints and things like that they're a lot more easy because of the hormones that you produce, and you get a lot, because obviously your pelvis is preparing for childbirth and stuff like that, that you don't have as many problems when you're pregnant. And of course I became really, really poorly, and eventually I got to see my GP and everything, because when you're a mum and you struggle on through, oh, I'll be better tomorrow, I'll be better tomorrow, and I definitely am, and I have got a really high pain threshold as well, so I was just sort of like going along with everything. Anyway, I became really, really, really ill, and I ended up being put into hospital with a pneumonia, and anyway, it came back that what I actually had was bird flu. And it turned out that the house down the end of our road, they were breeding tropical birds. That was fine, but they had a poorly bird, and what they were doing is they were burning the bird, all the bird droppings, they were like burning them, which then meant that all the germs became airborne, and if you're a bit low, most people can kind of shrug that off, but if you're a bit low and a bit vulnerable, then health-wise, then obviously it affected me, and it made me extremely poorly, and the environmental health were brought in and all the rest of it, and it turns out there was about 10 people affected by it. Anyway, to cut a very long story short, one of the side effects of having that leaves you with joint pain. So I was for some time seeing like the under the respiratory clinic because of the joint pain, which they thought was related to the bird flu that I'd had. after so many months, I think it was 6 months, they said, look, if you're still having all this trouble, then we're going to have to pass you on to rheumatology, because if it was related to the bird flu, within 6 months those symptoms would have all gone, when in fact mine was actually getting worse. So I got handed over to rheumatology, and there lies my future, really. I was diagnosed with rheumatoid arthritis, and it has been a long journey and a long struggle. So yeah, I've been diagnosed for quite some years now. And I kind of started off with all the normal medications that they give you. When you're very first diagnosed, sometimes it's difficult. Well, it was back then, it was difficult to go straight on to the really good drugs that are out there to help prevent it getting any worse. I think these days it's a little bit different. I think these days, if you're just diagnosed, they try to get you onto those ASAP to try and sort of halt it, to keep it in its tracks a little bit. But back then they didn't, so you had to start on like a level down here of drugs, and if that didn't work, they'd put you here, and then here, and then here, and then here, and that's what happened to me. So I was on sulfasalazine, I think it was, for a long time, and it, you know, and other sort of like anti-inflammatories, that sort of thing, and it did sort of help for a bit, and then suddenly I'd have lots of flare-ups, and that wasn't enough. Those drugs weren't enough. And then, let me think, then I went on to methotrexate, which is also a cancer drug. Now, methotrexate was excellent as far as the rheumatoid arthritis was concerned. It was an excellent drug, and it really helped me. However, I then ended up under a consultant for my liver, because it absolutely just played havoc with my liver. And for a while they took me off it to just let my liver recover. So then I was having all these flare-ups again, and then they thought, right, you've had an adequate break, let's see what happens if we try it again. So they put me back on the methotrexate again. Bam, within weeks I was like way off the chart with my my liver function. Wasn't good, so you know, I had to go back, and anyway, they had to stop the methotrexate because there was absolutely no way that I could tolerate it. Fantastic as far as helping out with the rheumatoid arthritis, but not for my liver, so it just caused another problem. So off I came from that. And then I moved from Southampton to Portsmouth, and I was then under another hospital, the Queen Alexandra Hospital in Cosham in Portsmouth. Absolutely amazing, honestly. I saw my consultant there is an absolute genius when it comes to his profession. He really is. He writes papers on the disease. He has the first pieces of machinery, and then he goes around the world teaching people how to use these particular pieces of machinery and stuff like that. And actually he was appalled by the treatment that I was receiving from where I was living before. So it just goes to show, though we weren't that many miles away, how they did treatment in this hospital to how they do offer treatment in the hospital I'm now in was completely different. I will add into that though that the hospital that I now see, which is the QA, where I live, it's very military, and we have Army and Navy, particularly Army and Navy here anyway. So the hospital, a lot of the consultants, doctors, nurses from the military also work at the hospital. But that doesn't cut into the hospital's budget, because they're still paid by the military. So although the QA have a budget for their own sort of for their consultants and all the rest of it, they also have the bonus of having the military medical team in there as well. As I say, it doesn't cut into their budget. So, you know, I mean, and the military people that work at the hospital, they may have just come back from Afghanistan or whatever. They've all been serving, and when they come back, they then work at the QA. They can be called out at any time to go, they have to go back into action and be posted somewhere. So yeah, there is that benefit. So they kind of, their money, they perhaps can invest more money in other things, I don't know. However, I can say it's been incredible. Now, my consultant there immediately changed. Immediately changed my medication. He had, my consultant in his consulting room has a piece of machinery. It's a scanning machine that's specifically for rheumatoid arthritis, and he can scan your whole body with it, and it shows up exactly where you've got inflammation and the joints are particularly in trouble. So that was a really good indication for him as to how my body was at that particular time. Now that I'm going back now about 7 years, maybe, let me think, 4, 8, maybe getting on for 8 years now, something like that, that I've been going to the QA. Now, he immediately got me onto some infusions, an infusion of different drugs that was put together by infusions are patient specific. So anyway, I'd go on the day ward, and I'd just have an infusion. They put cannulas in, and I'd have my infusion of various different drugs, you know, just done intravenously, and it would probably take me a morning up there or something, or an afternoon, depending on the time of day that I had it. And I'd have that every month. I'd have an infusion every month, and then I'd be topped up with various different tablets. And wonderful, absolutely wonderful. I started to feel absolutely brilliant. And then I did have like some other drugs introduced, particularly if I had flare-ups and stuff like that, but it was the best that my arthritis had been, and it was the best I had felt, until one day, and then I became so ill. Oh dear, did I feel ill. I really did. I mean, I'd already had my pneumonia jab, I always have a flu jab, the rest of it, but this one particular time, and now I'm probably talking of about maybe 6 years ago now, I was so poorly, so poorly, and I was coughing and I was coughing and I was coughing, but you know, once again I was oh, I see how I am tomorrow. Chris kept saying to me, I'm going to ring the doctor. No, don't ring the doctor, I'll be fine tomorrow. Let's go to the doctor. No, I'll go tomorrow, I'll be fine. And this is how I carried on, and absolutely ridiculous, really. However, so anyway, this one particular morning, Chris said to me, come on, I'm just getting you down the doctor's now. He phoned up, said that he was bringing me down, and it was literally just down the road, so we could walk there, and went straight into the doctor's. He took one look at me, and he was straight on the phone to the hospital to say that he was sending me up and could they get a bed ready. Anyway, I was very, very ill, and later they told me, had I waited 3-4 days, I may not be here today. That's how poorly I was. Anyway, I had a lengthy stay in hospital, followed by lots of episodes of being taken back into hospital. So to start with, they were treating me for you know, pneumonias and all the rest of it, and nothing was working. I just wasn't getting any better. I had had CAT scans, I had had MRI scans, I had loads of other things done. And then they had to bring in the thoracic surgeons, a team of thoracic surgeons that are based at the Royal Brompton Hospital in London, because everything they were doing, nothing was really working. So they then decided to just strip me literally of all drugs. So I had to have, of all the drugs I was medicated for, so they literally had to give me antidotes for every medication I was on, prescribed medication that I was on. I had to have antidotes to get all of them out of my system so they could kind of really start again and look and try to work out. Now, the Royal Brompton wanted to do a lung biopsy, but I was actually too poorly to be sent to London to do it. I wasn't well enough to travel, so they couldn't do it. So it was lots of trial and error things, really. Anyway, I will cut a long story short because this video is going to go on for ages otherwise. It turned out, after lots of investigations, after lots of testing, it actually turned out that the rheumatoid arthritis has now gone into my lungs. It can go into your heart and it can go into your lungs. And it had gone into my lungs, and what they discovered was, you know, this is the best way I can describe it to you, is, you know, in your lungs you've got like your alveoli, and they're all these little bits in your lungs do this, and they're like, they just move around, and when you cough or get any sort of infection in your lungs, they do, and they help you like this, they help you to cough and stuff like that. Mine, in both of my lungs, the bottom half of my lungs, in both of them, has now become like coral. If you know, if you think of coral when it's out of the sea and it goes hard, well, all my little bits like this in my lungs, they've now turned hard like coral, so they don't, at the bottom, they don't work, which means that I'm really prone to things like pneumonias and chest infections and stuff like that, because any fluid that builds up on my lungs I can't kind of cough up. So I do get a lot of coughs, I cough a lot but can never clear my lungs. Anyway, so one of the first things they had to do was to get into my lungs to give them a good drain, and it's called a bronchoscopy, and you are awake. They do sedate you, but you're awake because you're sat up while you're having it done. So you go into theatre, you are sat up, and then you've got like a whole team around you, you've got people in front of you, you've got monitors and people behind you, and what they do is you have sedation before you go in, so you're a little bit woozy, and then when you get into theatre they put a spray up your nose and spray at the back of your throat, and what that does is it paralyzes your vocal cords. And when I had my very first one, I panicked because you couldn't speak, you couldn't make a sound because but internally you were, but you couldn't be heard or anything. And then what they do is they go, if they can, they go up through your nose with all the suction stuff. If they can't, then they go in through the back of down your throat. Anyway, so they go up into one side and they go into one lung, and then they suck that fluid out that's in there. They then put clean fluid in to give it a good wash out. They then take a couple of biopsies from your lung. So they give it a good wash out, and you actually feel like you're drowning. That's the only way I can describe it is. But obviously you can still breathe because you've still got one lung, but you do feel like you are. I felt like I was literally drowning, and the people in front of you are trying to give you like nice thoughts and nice, you know, right, do you remember when, you know, that sort of thing, to try to take your mind off of it. And then they suck out all of that clean fluid, they suck all of that out, and then it's repeated on the other side. The only thing I can say about it is, my very first one was horrific. I was absolutely panic stricken. But afterwards I could breathe. It was like, oh, it was just so pleasurable. I could breathe, and I could feel the cold air in my lungs and everything. It just felt amazing. Since then I have had so many bronchoscopies that I can't even tell you how many I've had, and I welcome them now. I know what's going to happen, and none of them have been anywhere near as bad as the first one. It's probably a bit like having a baby. You don't know what to expect first time round, and you think, I'm never going to do that again. You have another baby, and it's like, actually, my body knows what it's going to do this time. So none of them have been that bad, and actually I have said on fair few occasions, I think it's time I have another bronchoscopy, because I know I need it. In between all that though, so I had my first bronchoscopy, but leading on to before I had all my others, the Royal Brompton in London, they decided that they thought the best way, because it's very unusual for it to go to your lungs. Obviously I'm not the only patient that it has done that to, but it is quite rare. So they decided that I should have a 6-month course of chemotherapy for it. Now the reason behind, when they suggested chemotherapy, I was like, why? I mean, is there something else you're not telling me? And then they explained the reason they wanted to do it is they were hoping that it would kill off, the chemotherapy would kill off a lot of the bad cells in my lungs. Of course it affects every other cell in your body, but that was what they really wanted it to do, and that in time my body would grow and make nice new fresh cells. So anyway, I embarked on the chemotherapy. I had it every 2 weeks for 6 months. It wasn't as bad as I thought. I imagined it being like every other case I'd seen on the TV, but for me, only me personally, I imagined the very worst, and it wasn't that bad as I imagined it could be. I didn't lose my hair, it did thin. I did lose the occasional clump. I remember the first time I lost any of my hair, I woke up and there was a lot of matted hair on my pillow, and it had actually, through sleep, it had actually gone into a heart shape, and I still have that. I've kept that, and I thought from that moment I'm going to lose my hair, but I was quite lucky. I ended up more like Coco the Clown. My hair just became incredibly thin, and every time I combed it or brushed it, I just had loads of hair in it. But a small price to pay, isn't it? I know. I think the sickness was okay. I had anti-sickness in the hospital, I had anti-sickness at home. It kind of knocked me off my feet for the first couple of days. I suppose I just slept, and then I started to build up again, and then it would be time to almost go and have the next lot. But I think the most upsetting thing for me was not being able to see an awful lot of my grandchildren, because they were all so very young then, and as you know, little children are little germ machines, aren't they? You pick up everything from kids. If I was out in an open space, that was not so bad, but I couldn't have them indoors, couldn't meet them inside. Things like going shopping and that, I either had to go to the shops really early in the morning so that I was like one of the first customers in before the shops had like masses of people go in, or very late at night so that a lot of people hadn't been in, you know, like the 24-hour shopping, and so there's been like a decline in the amount of customers going in, and then I could go in sort of then. But I ended up doing a lot of shopping online, that sort of thing really. Anyway, so I did that for 6 months, and I have to say it worked absolutely fabulously. It was absolutely brilliant. I seem to have a new lease of life. It worked very well. They have said to me that it will go full circle again. They are expecting it to happen at some point, and they have already decided which chemotherapy drug they will use on me next time, so I am aware that it will happen again. But as I say, I've had loads of bronchoscopies. I'm also now on, I now take, following that, let me just say, following that, obviously I now see a consultant for respiratory as well. So I have a respiratory consultant still, an rheumatology consultant, and still with the Royal Brompton. So I still see all of those three, and they all liaise together, because what works very well for rheumatoid arthritis actually has adverse effects on your lungs. So it's been very difficult for the consultants to come together to say, let's agree on this drug, because I'd have my respiratory consultant saying, there's no way she's having that, because that's just going to cause her lungs more problem. And then you've got the rheumatology consultant saying, but her joints are just deteriorating so much. So anyway, they all had to come together again and decide. So when I initially had the chemotherapy and everything, I was on mega high doses of steroids, huge doses of steroids, and I'll insert a picture of what I look like. Awful. I had what they called moon face. So if any of you sort of take steroids or know about steroids, you get this, you get a really round moon face, and you bloat and everything, and I looked awful, but you know, I had to take it. And also they started me on, I now have to self-inject every week with a biologic injection. So yeah, I'm now on like these biological injections. They get delivered to my house once a month, and then I have to just inject today. Actually, it's on a Thursday that I inject into my stomach. And so, you know, if I go on holiday, that sort of thing, flying, I have to take all of those with me. They have to be kept at certain temperatures, but that's another thing altogether. So I'm on 32 tablets a day now, and I have my biologic injection every week. Now, since then, I have developed a little bit of a heart problem. Right now, they are thinking it's unrelated. Fingers crossed it's unrelated, but I kept just passing out, having these syncope attacks, and I'd just pass out for no reason, just totally lose consciousness. And what they discovered was that the left chamber, I think it's the descending, the one that takes the blood away from the heart, sometimes it doesn't work properly, and it kind of forgets to pump it away, and it's just so sort of slow that then the blood can't because that's not pumping away, the fresh oxygenated blood can't then come back to the other side. So then I get like a lack of oxygen to the brain, and that's why I pass out. But I have since then, I've got a monitor now fitted. It's fitted here inside of my chest in here, and I can feel it. And I have a device next to my bed that constantly picks up readings and sends it through to the QA, so they can pick up on the readings all the time. If I do have like a funny 5 minutes and I go, then if Chris is with me, he can get one part of the machine next to the bed, and he can hold it over the monitor inside of my chest here, and it will send an immediate for the last 15 minutes reading under a special alert to the hospital, so they can see it. And I've also got another device that is one that I carry with me in my bag. It's a much smaller one, just a little mobile device, so if I'm away and if I'm out in the house, if somebody is with me, of course, to know that they need to do it, then they can do that as well. But so far we're hoping, as I say, fingers crossed, it hasn't gone to the heart yet. So that is kind of where I am with it, guys, really. So I don't know if this has given you any sort of insight to this awful, horrible autoimmune disease, which is what it is. You know, I get everything going basically now because my immune system's so blooming low, through medication. That's why, because with rheumatoid arthritis, it's your body is reacting to itself, really. You're producing too many white blood cells, and then your body goes into attack and it attacks your white blood cells. So a lot of the medication is to kill off some of the white blood cells so that you don't have so many, so you don't get that attack going on. But because you have a lack of white blood cells, your immune system's very, very low. So that's it in a nutshell, really. So I hope this has helped, and I hope I've explained it enough. If you've got any questions, just send me a message or just comment in the comment box or something, because there's things that I may not have covered for you, but I'm hoping that I have. I'm extremely tired today. A terrible headache. I don't know why. It's just one of those things. You get very, very fatigued with rheumatoid arthritis. That any of you that have it, you will know how unbelievably fatigued. It's on a whole different level to feeling tired, and that's how I'm feeling at the moment. So I've come out in all this, and yeah, just a bit knackered at the moment. But I thought, I'm going to tell you guys now, because it is something that a lot of you have been asking me about. So I hope I have, as I said, I hope I've described it well enough for you. But yeah, any questions, just drop me a line, or, you know, just ask me, and I'll be honest and I'll tell you. And I will see you guys in the next video. Thank you so much for getting this far, because I know I've waffled on for a little bit, but it's something I couldn't do in just a 5 or 10 minute video, you know. And yeah, see you in the next video, guys. Till then, stay safe and stay fabulous. Bye. Bye.